emphasize that people who are HIV infected should be very compliant to their Septrin. And every time they visit a health worker, the health worker needs to remind them to take their Septrin prophylaxis as well as their ARVs if they're on ARVs.
Dr. Pauline Biachika, a physician and an associate professor of medicine, also doing research with the Infectious Diseases Institute, says that Septrin, or cotrimoxazole, is a preventative medication against diseases such as malaria, bacterial pneumonia and diarrheal diseases which easily attack people with HIV. With Septrin, clinical malaria amongst people with HIV can be avoided. Co-infection with malaria is a fast way for someone's life to deteriorate. And where HIV is, malaria also easily creeps up.
Research has shown that if somebody has HIV and their immunity is low, they are at risk for getting malaria, both the uncomplicated form of malaria as well as the severe form of malaria.
Dr. Biachika says if one is eligible for ARVs, they have to take them as well as anti-malarial drugs. Does someone, however, have to worry about the effects of drug interactions?
There are a few published studies that show that especially when patients are taking specific certain types of antiretroviral drugs, that is the PIs, especially lopinavir, ritonavir, and they are given antimalarials, there's an increase in their concentrations in circulation. So they tend to do better, and they also tend not to get as much malaria as those who are not taking those drugs. But on the other hand, there's another type of the antiretroviral drugs, especially efavirenz and nevirapine, that tend to increase the activity of enzymes that break down the antimalarial drugs. And in that case, we have found that if patients take these drugs together with the antimalarial drugs, then there's a decrease in the antimalarial concentrations, which is worrying because this could lead to therapeutic concentrations, and this may predispose to treatment failure. But we haven't yet studied the clinical aspects of that.
While some people say that to prevent malaria in an endemic populace, it may necessitate taking the drugs used for its treatment, Dr. Charles Katorebe, the WHO country representative, says this comes with many disadvantages.
Prophylaxis is not recommended in a country like Uganda, where the transmission is very high. If I can tell you that when you go out, we have done a malaria indicator survey, 2009, about 66% of children under 5 in the community were found with parasites in the body, and when they are not sick. So there is high immunity within the population because of that repeated infections, those repeated infections. So the prophylaxis would work for somebody who is coming from a malaria-free country and is going to high transmission.
If we misuse the drugs that we have, we're going to lose their potency. The parasites are going to get resistant.
While she says indoor residual spraying, sleeping under mosquito nets and clearing the bushes may keep malaria at bay, for the HIV-infected people, she does emphasize the use of Septrin.
Anytime a medical worker tests somebody for HIV and finds that they have HIV infection, they should start them on Septrin, daily Septrin prophylaxis, because Septrin has been proven to prevent malaria.
A study conducted in Mali, published in the Journal of Infectious Diseases in 2005, backs that claim. It states that a short course of Septrin provides almost 100% protection against malaria. Globally, according to the WHO, malaria kills about 627,000 people per year. The dedicated taking up of Septrin amongst people living with HIV may just help drastically cut those numbers. Florence Salimba, NTV.